So I still see names joining, but I just want to say that I want to thank the associate deans who've all joined me, and hopefully you can see them all on your screen now. We have all been working hard and continuously, and we just are so glad you're all joining us. And one of the things I want to talk about today is how we can stay connected while we're distant. I know that everybody's reading and thinking about that constantly. And for our School of Public Health community, I think that's really important. So again, I want to thank the associate deans and Pam also, who's part of the group, who's the continuity planning group. We meet every single day. We have for about a month in preparing for this and managing this. And hopefully all of you know that the many people working really hard at the school, including all of you, to make sure the show goes on. So I want to thank all the associate deans who you can see now, and then at some point you might not be able to see them. So Matt is doing his magic as usual to bring this to all of us. So good morning. I'm so glad you're all here. I know that this has been a challenging time for all of us, and really, this is the beginning of a new way for us to communicate. I spent my morning, a little bit of my time this morning thinking about what are the lessons I'm going to take from this to bring on in my life. Because there's lots of things that are good that are happening, maybe in unexpected ways, and new kinds of relationships, new ways to support each other, new ways to be kind and be grateful. And so I encourage all of you, in the midst of all the things you're struggling with, which I know are many, to also try to spend a little time thinking about what are some of the things that I might actually be able to take from this experience that might enrich my life going forward. So again, this is the first time we're doing a chat like this. I imagine we'll be doing more in this new way of operating. And the thing I really want to start off with by saying is that the School of Public Health is open for business. Brown University is open for business, and all the hard work all of you are doing to make sure our students, our faculty, our staff, our postdocs, and all of our trainees are taken care of and our community members is just phenomenal. And I appreciate all that everybody's doing. And I think we should all give each other a round of applause, a pat on the back, and really thank you all for all that you're doing. You've heard me say many times over the last few years, it takes a village, and it surely takes a village, and a creative village, and a technology-oriented village to keep everything running. And it's just so exciting that all of you are doing exactly that. So thank you. What I want to do is review a number of things, and then I have several of you have sent in questions, which I'm going to answer at the end of this. And then for those who have additional questions, we'll talk about how you can get those questions answered. And we'll probably later in another couple of weeks do something like this as we again adjust to this new normal. And I'll probably say it a couple of times because it's so important that we figure out ways to connect while we're distant, including this Zoom. I mean, you all have the capacity to have a Zoom lunch with each other. Maybe there's somebody who you normally would have lunch with or normally would see once a day. You can send a text, but seeing each other is really important. And that's one of the things I think that we're all sort of missing out on by not being in the office together. And there couldn't be a more creative group than all of you. So figuring out creative ways to stay connected, we really want to encourage and share. So in terms of thinking about the most important thing, and that's really all of you taking care of yourselves, which is hard to do. And many of you have many responsibilities for children, for parents, for pets, for all kinds of people in your world. And normally you have more of an opportunity to separate a little bit from that when you're at work. And now it's all just mushed together. I mean, I know it is in my life. And so taking care of yourself, figuring out a way to go for a quick walk or do whatever, do inside exercise or movement, that's my go-to, being an exercise researcher. And different of us live in different places with different rules by our governors and things like that. But if you can find a way to stretch, to walk, to do something, meditate, whatever it is that will give you some perspective, I really encourage you to do that. And I want to just make sure that is, really that's the most important thing for all of us is to find that, and to share that. If you have something that's working for you, please share that. The news is full of all the things that aren't going well, but all of you I know have things that are going well, and sharing that's really important. So take breaks, rest, and follow the CDC guidelines to stay healthy. That's the most important thing. I want you to know, and I think you've seen the messages, or if not, please go to the website for the Mindfulness Center. The Tuesday mindfulness sessions that we did in live are on Zoom now, but the Mindfulness Center also has mindfulness programming every single day of the week. It's free, it's available to everybody. And so I encourage you to use it, and I encourage you to connect your family and friends to those resources also. You know, and as I mentioned, think of creative ways to connect with each other. So I want to update you on a few talks around teaching, around research, and around our connectivity to the community. This is our first sort of virtual meeting. I'm going to keep this relatively short. It'll probably be about 15 minutes. And then, as I said, we'll be doing more of these going forward. So there are many emails and many updates from the university. I know for a while there, it was a flurry and it was hard to keep up with. It's really important to keep up with. There's lots of information in them. And also I want to remind people, everybody has bookmarked the Brown's COVID-19 website. It changes often. You don't always get an email telling you. You often now will not get emails telling you that it's been updated. Unless something really major happens, then there's also an email. So please check it regularly. It really will help guide you. It will guide you in your role as a staff member interacting with students and faculty and researchers and community members. It guides you if you're a faculty member. It guides you if you're a trainee. It really guides all of us there. So I really encourage people to use that resource. I mentioned at the beginning that the School of Public Health is, it has been continuously open for business, as has the university. I mentioned our continuity team that meets daily. I have in many, many meetings that are meeting daily and weekly, the senior dean's group, the president's cabinet, the president's executive committee. Next week, we're off for this week. Those meetings have gone on daily or weekly and will continue to, that I mentioned. Because this week is spring break, there's no APC and TPAC and some of those other meetings, but those are all open for business next week via Zoom. So really everything at the university is continuing, just in a new way. And so that new normal, or whatever we want to call it, is what we're really adjusting to. So one of the many communications that you received is about commencement. And I know we're all disappointed that commencement won't go on the way we thought it would. Students will receive their degrees so that they can go on with their lives and hopefully jobs and whatever their next step is. And you've heard seen the president's communication that we might not all gather together physically to celebrate until October. That's potentially when it will be, but there will be some kind of degree conferral over Memorial Day weekend as usual. The details of all that, as well as that spring corporation meeting, are all being worked out. But again, many of you, all of you really are directly involved with our students and are reaching out and supporting them. And I really appreciate and value that. And I think this every day it seems like different news comes and all of it affects our students. And so the commencement, I know, is disappointing. So for those of you who are in contact with students, which I know is really most all of you, reaching out and supporting them in this way, as well as you do about the teaching and the virtual learning and the research and so much else, is really important. So let's talk a little bit more about the students. So next week we start our online instruction that will kick off. And Melissa Clark, first off, an amazing shout out to Melissa for leading us through so much of these changes with the virtual learning, while at the same time just being knee deep in leading us with CEF, where we are on track for our reaccreditation. And just so everybody knows, while much of the world has stopped, nothing about CEF has stopped, nor their expectations for us. Melissa and Patrick had a virtual meeting last week, and we are still expected to meet all of the milestones this spring, this summer, this fall, next winter, et cetera. And we are working hard at doing that. So really a huge shout out, especially to Melissa, also to Patrick and everybody else, Barbara, who are so involved in that mission. So So again, that, we're, from what Melissa and the department shares and all are sharing, faculty are really stepping up, and we should be in really good shape to be virtual next Monday. I want to remind all the faculty who are listening in to review the temporary academic policies for spring 2020 posted on the teaching and learning section of the COVID website. And again, going back to that COVID-19 website, there is something on there for each of us and many things that are relevant for all of us. So please always have that be your go-to spot. Also, Dean Campbell just sent another email yesterday clarifying some of the guidance on this process for being virtual. And actually, with classes starting again next week and all be virtual, I'm hoping that brings a little bit of a sense of schedule and normalcy for us. I know many of us are working at all hours and trying to figure things out. And I think having something scheduled like that will really help all of us. So I'm hoping that does, and hope that is helpful to all of you as well. So again, thank you to Melissa for her amazing leadership. So let's talk about research. So Public Health Research Day will go on. It will be as scheduled. It will be virtual. And so I want to thank Jen Tidy and Barbara Daly and many, many others who helped us transition to a virtual format. All the posters will be viewable online to the public on Monday, April 6th, and we will share a link when it's available. I think you all know we have delayed other parts of Research Week to the future, and we will still be having judges review the abstracts and providing awards, and that will come later in April. But Public Health Research Day will go on, and there will be many ways for all of us to pause and think about Public Health Week. I mean, here we are, public health leaders in the midst of a public health crisis, which brings so many challenges, but so many opportunities, including new research opportunities. There are regular calls coming out now for people doing research and studying COVID-19 and studying patterns and studying clusters and so many areas about this. So huge opportunities for us, and Public Health Research Day and week will go on just in a different way. So speaking a little bit more about research, one of the huge undertakings that Jen has led us on are figuring out how to take care of all the human subjects in our studies and what we can do for becoming remote. We were all told we had to make our research remote, and there's been a lot of effort led by Jen and the center directors and all the PIs and all of the staff and postdocs working with them and grad students to make this happen. And so it's really been a huge undertaking, and we really appreciate all of it. And again, things aren't the same, but they can be great. And here we are to offer our programs and services to the community just in a different way. Again, back to that COVID-19 website, there's a lot about research on that website, and I encourage people to look at that. There's also a lot of questions and answers about telecommuting, about pay, what is essential work, so many of the kinds of things that are unclear. And don't be shy. I have to go back to that website all the time or get clarification on things. I mean, a lot of this is new things we haven't really thought about. Go and look. And then, of course, if you can't find what you need, reach out to one of us. For the postdocs who are calling into this, I encourage you, I know most of you have, but please meet with your faculty mentors to make sure you come up with a work plan of things that you can be working on. Again, they may be the things you were always working on. They may done differently. There may be different things, but please reach out to your mentors so that you have a plan that you're comfortable with. So in terms of our faculty, I'm looking forward to in the future announcing the Dean's Awards in Teaching and Research. That process has gone on. Thank you all of you who nominated people. And again, it's always one of the most delightful things I do to read all about all the amazing things people do and to read how you all care about each other and all the great things students say about faculty. It's really exciting. So we'll be sharing that later in the month. Also, I want to remind faculty that next week, next Tuesday, is the university faculty meeting. Many of you don't necessarily get to go to those because of other conflicts, and now I think it will be easier for you to Zoom in. I guess actually it's not next week; it's Tuesday, April 7th. So I really encourage you to attend that faculty meeting. A lot of things on your mind are on the minds of other faculty. These are things that we are sending forward to the provost and the president to make sure they get addressed. And I also think it will be a way for you to feel community with the faculty on the campus. So again, encourage you to participate. I'd like to update on a couple of diversity and inclusion related matters. First off, I want to thank very much Bear, who has stepped in, who's always been part of our School of Public Health team all along, but has stepped in while Caroline Kuo was out on maternity leave to really serve in the Associate Dean role. We really appreciate, Ron, your involvement. Also want to share with everybody that Caroline is doing great, and she will actually be back to work next week. And looking forward to reconnecting with the community in this new way. She said that the community, and she have changed a lot besides her having the baby, because obviously a lot of change in the world has happened while she's been out. So she's really looking forward to reconnecting. And Ron, again, thank you so much for your partnership. It's been fabulous. Tomorrow, the Graduate Students of Color group is hosting a check-in via Zoom from 2 to 3. So I want to ask you all who are connected to grad students to encourage the graduate students of color to participate. And that group is also going to discuss potential resources and emotional support in this time of social distancing and isolation. And in general, we are regularly in touch with OIED regarding any matters of reports of discrimination and bias. So really all of our reporting structures and supports are in place. Again, they are just a little different. So I wanted to talk a little bit and highlight for you some of the amazing things that our faculty, staff, students, and alumni are doing out in the community. So we have, our director of the Rhode Island Department of Health, Dr. Nicole Alexander-Scott, an alum of our school who's just out there. I'm sure you all would need to completely have your head in the sand to not have heard her on the radio, seen her on TV, read about what she's saying, really right there as a partner with the governor on managing this public health crisis. So I think we have very much to be proud of. And thank you all of you who are reaching out. We have the epidemiology faculty, Steve Buca, David Savitz, Mark Lurie, Angie Bankson, so many of you working with the health department, doing tracing, helping manage things. And we really appreciate that. The graduate students and postdocs are hopefully getting involved in that or will be involved. I'm regularly in touch with Nicole. There are a lot of needs in our state, and the reality is they're going to continue. So we really appreciate people stepping up. And even if you're feeling not so confident about what can you contribute, I'm sure there's something that you can contribute. So thank you. We hear a lot in the news about Megan Rainey, again, one of our alums who is just in the emergency room, managing things, trying to be on the forefront. She is on the forefront of managing the situation and thinking about prevention, thinking about creativity. Again, I mentioned that a number of the faculty in epidemiology, Jody Rich is also out there in doing amazing things for the community. Judd Brewer, the Mindfulness Center overall is offering much programming, thanks to Eric Laux, Diane Horgan for that. But Judd is also, on podcasts and YouTube and talking a lot about how to manage anxiety, how to manage things in these uncertain times. So again, thank you to Judd. So thank you, all of you. I'm sure I'm not mentioning everybody who's doing amazing things, but we really have a lot to be proud of in this community. And there's a lot more need out there. So for those of you who want to step in and do things, will be opportunities. And also on our website, there's a link with all the articles of all the things that we're tracking. And of course, thanks to Karen Scanlon for keeping us connected and up to date. We had a new newsletter released, which hopefully you all saw, which has amazing resources in it. And the newsletter and on our website, you'll see links to the many, many stories of our faculty being interviewed and a summary of all the great things they're doing. Of course, every day people are out there doing more great things. So it's not completely up to date, but there's many, many things on there. Some additional things that I want to mention is that one of our SEM candidates, Tonya Faye Sanchez, has been, and she's a student ambassador. She's been distributing information about how to help children through this stressful time. And that's been used in many, many universities and here at the Annenberg Institute, and very well received and really important. The Center for Alcohol and Addiction Studies, under Jen's leadership, amassed 52 boxes of gloves to donate to Rhode Island Hospital and other protective gear. The Center for Evidence Synthesis and Health is working with the Rhode Island Department of Health, collecting important data for people who are quarantined. Amy Nunn and Phil Chan we just opened this amazing center called the Open Door Health Clinic to focus on the LGBTQ community, and they're very much, both of them, involved in the coronavirus and how this is impacting that community, and how to support the community. So there's many of us working at different parts of our community, and it's just, you know, really, really exciting and important. A shout out to Abdullah Shilapar. I'm sorry, Abdullah, I always struggle with your last name, but I don't struggle remembering all the amazing things you're doing for the school and for public health. And he's been managing an Instagram campaign to keep people connected and to have people share photos and videos of their pets. So again, sometimes we need to create these lighter, warmer moments for ourselves during these challenges. And thanks to Abdullah for his effort at doing that. One of our gerontology postdocs, Betsy White, has been working clinically as a nurse practitioner at the PACE organization, working to keep 350 medically complex older adults safe. I've heard many things going on with our, Rosa Bayer keeps us updated on center directors meetings about what's going on with the nursing homes and all the amazing connectivity. So again, the center directors and the executive committee, we've been meeting originally daily, then 3 times a week, and we are in very, very regular contact meeting too, and people are sharing what's working and what's not working. So for all of you who, everybody is connected through departments and centers, and so please know all those leaders are really regularly working and in touch with each other, and feel free to reach out to them if you need any guidance on anything. So there are many, many examples that I could share. And I just want you to know the amazing things all of you are doing out there in the community, as well as with our research and our teaching missions. So I mentioned that we're repackaging Public Health Week. We're carrying on with Public Health Research Day, but we're repackaging other parts of it. There'll be a panel on the coronavirus in a virtual event on April 14th. And that will be done in conjunction with Biomed and Watson. Again, it was something we had planned during the Public Health Week, and we're just doing it slightly differently. So there'll be more information coming out on that. And again, thanks to Mark and Angie and all those who are involved in the coronavirus panel that we did in February. February seems so long ago, that February session, because we were, we're really at that point observing what was happening in China. And here we are just a month later in such a different place. We are working collectively with the Department of Psychiatry and Human Behavior. A number of us were on a call on Monday with Steve Rasmussen. We're trying to figure out how we can offer more mental health opportunities for people and well-being opportunities. So we're working on that collaboratively, and we'll be building off of some of what we're doing in the Mindfulness Center. And the Hassenfeld Center has a virtual question and answer up to talk about people, new and expecting parents. There's so many concerns. There's so many concerns for new and expecting parents anyway, but then they're magnified dramatically in this particular situation. So, so there's a Q&A there. So just, want to recap here that there's so much that people are doing, and this is such a creative, dynamic group. And I love the out-of-the-box thinking you all are doing. I know people are working really, really hard, and many of you are working hard in really challenging situations. And so really appreciate that and appreciate the creativity. And I really appreciate if everybody shares also what is working for them. So I want to thank everybody for your work. Thank you for being part of this community always, and particularly in the ways you're stepping up now. And I think what I'm going to do now is just pause and answer a few of the questions that people have raised. So what do I do if I'm having trouble with getting my course ready for remote teaching on Monday? So this was a question, actually there were several questions about this from faculty and postdocs. So the answer is to reach out to Melissa as soon as you can. There are graduate students with expertise in Zoom and Canvas who are available to help you. Melissa just needs to know what your needs are, and she will connect you with someone. So please, it's Thursday, so please, if you're having trouble, and I appreciate that everybody's getting things tested and ready, please reach out to Melissa. Another question is, my research involves in-person assessments and I can't do it remotely. At this point, I'm paying my staff, but I can't do my research and the clock is ticking on my grant. I'm very concerned about covering this expense in my grant, trying to figure out how to get the work done. So there are several questions kind of like this that either deal with how do I get the work done and or how do I pay people? And so we know there's a major concern about this. I think there's good news about this. And we will send around an email following this for people, but there are a number of calls on the NIH webpage about supplements we can get on our grants. They recognize the challenges. They want us to keep supporting our staff. And, you know, while it's not exactly like the check is in the mail, there are going to be many opportunities for us to apply. So PIs out there, you know, be reading these, be talking to your center directors, and reach out to Jen as needed. And we will be working to find ways to make sure everything stays covered. We are closely monitoring the NIH website, OSP, the OSP website, and then the websites from the different, you know, besides the NIH overall, the different institutes. Some of you have received direct letters from NIDA, NIAAA, NHLBI, some of the institutes about specific instruction. So I know this is a challenge, but I know we all want to make sure everybody stays employed and stays whole. And so there will be a lot of efforts for that. And again, I really want to call out related to this question. There's also the question about what can be done remote. People have done a fabulous job at figuring out how to do assessments and to do intervention remote. And so kudos in the Center for Health Promotion and Health Equity, and in CAS particularly. Also, I know in epidemiology in Brandon Marshall's group, and I'm sure there are other groups too. And I appreciate everybody's effort and care to keep providing treatment to people who probably need it more now than ever, even during challenging situations. So numerous great links for some of these research concerns, and I encourage people to reach out to their center directors, and the center directors are regularly in touch with Jen. Another question, and this will probably be the last one I'm going to take now as I'm getting messages from people that we need to wind things up, is that will the hiring freeze affect hires that are funded by research grants? And I have confirmed that with the provost that our positions, staff positions, faculty positions that are fully funded on research grants will not be affected by this freeze. So I want to assure people of that. I know that's a lot of the employment of people in our school. And really, as I mentioned before, there are more and more opportunities now for us to be getting new grants. In a lot of the different areas we're studying, and actually in every area, this virus, this pandemic are impacting things. And so there's huge opportunity for us to be writing new grants. So that will help us all in the future, the school and all of our students, faculty, staff, trainees. So just in closing, I want to thank everybody. I want to thank you for taking the time to be on today. I want to thank you for whatever you're doing to create normalcy in your life and some fun in your life. I want to just thank you for being this part of this community. I want to recognize the challenges of people. You know, I know many of you are parents and you have kids at home, whether they're little kids with care centers closed or older kids where you're supposed to be trying to manage the homework that they're supposed to be doing, whether it's virtual or not. There's a lot of challenges, and many of us have had to kind of be creative in how we get all our work done and still take care of all the other needs. So really a shout out to all of you who are balancing that. I'm doing that, and it's a struggle, and so I understand that challenge, and really applaud all of the creativity that people are doing. And some of our work days have to just move around a little bit, and you know, maybe we're doing more work really early and really late. We're all getting the job done, and we're doing it creatively while we manage everything else. So I encourage that, and I think just on closing, while we're talking about managing the work and caring for our students and caring for our children and elder adults in our life and everything else, please take some time today and every day to take care of yourself. So thank you for joining, and I hope everybody has a great day and a nice weekend.